we've had some experience now of the online appointments and so video, telephone, you know, very small amount of face-to-face. And I just wondered if you were finding them okay still, if you've got any comments about them. All okay?
Yeah, I had a call from Chris Eads a week ago, Friday.
Good.
And I found it, I mean, it was very relaxed.
Yeah, good.
It was very good. He listened.
Yeah.
Most attentively.
Yeah.
He gave me, or he reminded me, I'd already had results of blood tests, which was done the last time I attended clinic. And all in all, he was most helpful.
Yeah, good. Good. Yeah.
And very reassuring, because he suggested that he would request me to have an X-ray locally, which I was a bit reluctant because of being nervous about attending hospital.
Yeah.
And I'd got to go for a different, well, it was a mammogram last week anyway. And he took the time to be most reassuring.
Yeah.
And said, you know, you're safer going to the hospital than you are going to Sainsbury's shopping.
Yeah, exactly. They've got systems in place to make sure that you're in a, you know, the least time and that you're called in and you're protected. So yeah, I think that's probably fair to say that's true. So the only other thing is, so that's the hospital side. Do you feel everything's covered well enough by your GP? I mean, they're absolutely, you know, overwrought.
They've gone into hiding.
They have gone into hiding. I agree with you. Absolutely.
Yeah. They've gone into hiding. You can ring through at our GPs to their call answering service.
Right.
If you can get through, we do it online. There's a facility. You can book a call back online. And I haven't needed to use it personally.
Right.
But they do. A doctor does ring you.
Okay.
But the surgery itself, well, I don't know where they're hiding, because the surgery itself has been closed for ages now.
Yeah, I would just echo that, Chris. I think my experience has been that surgery for a long time now has been routing everything through the Ask My GP system.
Yes.
Put your request online. They've been very good at ringing back, but they're clearly extremely reluctant to see anybody face to face. Which I have some concerns about. And just as an example, I recently started to experience chest pain. I had a heart attack years ago. Started to experience chest pain, which I've never had since the heart attack. And I phoned in and I went through Ask My GP. I got a call from the GP, explained my symptoms. He said she would refer me to the cardiologist. When I eventually got a letter from the cardiology team, it said that they'd reviewed the case and they decided a telephone appointment would be fine. And that appointment was for about 2 months hence.
Right.
Now, within about a week, I had to go into A&E because my angina was so unstable that I knew there was a problem. And I have to say that A&E at Wythenshawe were absolutely excellent. They had me through the door on an ECG within minutes of arrival. I was into resus. I was taken into hospital for about 4 or 5 days. I had all of the tests done. And, you know, they've diagnosed an arrhythmia. And so I'm now in a situation where I've got ongoing tests and treatment to come. But I have to say the hospital service was excellent. And it seems I didn't catch COVID either while I was in this. So that's good. But the hospital service, absolutely excellent. I am a little bit concerned that while on the one hand, there's a lot of publicity about making sure you don't neglect your other illnesses like heart and cancer and so on, that the GPs seem very reluctant to get involved other than remotely. And I do just worry that without seeing patients face to face, things are not going to happen quickly enough in some cases. Now, for someone like myself, because I've had involvement with the health service a lot, I felt able to access the services. And if I wasn't getting success through my GP, there are other things I could do. But it does worry me that people are going to go undiagnosed. It's going to be too long before they get treatment. And I don't see any signs of the GP surgeries becoming more accessible. You cannot do everything over the phone.
No, and that's partly why I've asked the question, just to get a sense for that. I think you're right. And I think they're overwhelmed because the hospitals are pushing out so many jobs for them to do on their behalf because people are not coming into hospital appointments. So most of ours are, can you arrange this? Can you book that? Can you sort that? I think they are just overwhelmed. But as you say, it's not very satisfactory for the patient. And in a situation like that, my immediate advice would have been A&E first, to be honest. In what you were describing, I just wouldn't have even gone near the GP.
I have to say the GPs did not say go to A&E. What I was describing initially was angina. When exercising, and they referred me for what I assumed would be the follow-up tests. Yeah. But actually, what came was a letter talking about a further telephone appointment 2 months hence.
Yeah,
which seemed as if there was a disconnect.
History as well. I think that's probably not.
Yeah, because on the one hand, I'm trying not to overload A&E, but if we're in danger of everybody, making A&E their first port of call.
Yeah, which is what you don't want. I agree. I was only saying it because of it being chest pain, so that's and not for other things, obviously. Because you don't want people to neglect that. That's an early warning sign, isn't it?
No. I think if you've had any involvement with the cardiology side, they give you pretty clear instructions about when should you take immediate action, i.e. 999 to go to A&E, and when so the difference between angina and angina occurring just at rest, for example. But for other people, if it's the first time they've experienced it,
you don't want them waiting 2 months.
You need the GPs to step up as well, I think. So I'm not sure the balance is quite right, Chris, I guess.
Yeah, I agree with you. Yeah. And then what the answers are, I really don't know.
Makes you wonder how they're going to roll out a vaccine program.
Yeah, exactly.
Yeah.
It's interesting when you go in. I went in for my flu jab. That was done at the surgery. And it was an oasis of calm in there. There were staff in every room. There were no patients, and I did just wonder, how well the resource has been deployed, really.
Yeah.
Yeah, I think there's something about, maybe I was a bit naive, but I following on from that, I think I was expecting at least a check phone call from the GP to check I was all right. And maybe that was me being naive, I don't know, but I just felt like there was a real disconnect. And I think, like somebody else has just said, it felt like they'd gone home, if that makes sense. So having said that, having the flu jab was really good. It was in the local sports centre and it felt very safe. So, they've done that well, but I do feel that perhaps I'm not sure what their criteria is, and I will check once all this is over. But just a thought. I mean, and definitely, I had my phone appointment from Wythenshawe on the telephone, and that was really good, and it was effective, and so. And I've got another one coming up in a couple of weeks, and that's going to be like a video one. I think I've got the links sent through, so I think that's a really good system. So for me, that works.
I have actually followed this story a little bit with GPs. And going back 2 months, they were indeed working from home mostly. But then they were bullied by the PHC to say you've got to come out and start meeting patients. And there was a bit of a kerfuffle about that, I think. But they just pushed out this week. They pushed out a huge increase in the number of face-to-face appointments being undertaken by GPs. something seems to have happened, and they seem to be more keen on actually getting out there. But remember that if you've got a GP who's sort of 55, 60, it's a whole different case as if your GP is about 35, because the older people are going to be as vulnerable as any other patient, and they're going to be seeing people. They're under a lot of risk as well. So I guess it depends who your GP is, where you are, what you're actually going to get. But it's perfectly true that they need to do the best they can.
And I guess I'm asking the question because, like Sandra said, there's going to be people out there that are not as proactive, and I'm worried that they'll just be left, and the GPs will just accept that it's all quiet and that's good. We've got so much to do. But in actual fact, there's probably people there that are just thinking, we're best not bother them, all right, I'll just wait. And I just worry that they're actually going to be neglected, and that's a concern, that they could be quite unwell and nobody's picking that up. So
absolutely, absolutely.
Fundamentally, there's going to change, isn't there? And I don't think we're going to go back.
No, I don't. But I think we have to smooth it out and make sure that it covers all eventualities, and that people can access things easily. And
I think the other aspect to this, Chris, is that the GPs, and this has been a problem for as many years as I've been involved, and I worked in pharmacy, so this issue was a big issue, certainly throughout my career, that the communication between GP surgeries and hospitals doesn't seem to be as good or as frequent as it needs to be. So that when you are referred by your GP to a hospital service, they seem completely unaware of what has happened to that referral. So they're unaware that they seem unaware that the referral has worked, and that the appointment has come through from the hospital, or the contact has come through from the hospital, and indeed what the nature of that contact from the hospital has been. So having listened to your symptoms over the phone and decided that referral is the best course of action, they then their interest seems to stop, and they seem unaware of what the outcome is. In my case, because I then had to go into hospital anyway, because my condition worsened quite quickly, I then got back onto the surgery and said, look, the referrals that you made for me are producing appointments which are months down the line, which are now irrelevant because I've had to go into hospital. But it was left to me to try and cancel those other referrals. And this seems wrong. I would have thought they should have been following up very closely what has been the outcome of their referral, and doing, and making the necessary communication on my behalf.
It's almost like their job's done. They've sent you on, and they don't want to know what the outcome is, because that's a piece of work done, and they can move on. Yeah, I get you. Yeah, definitely.
That's probably what it is.
Yeah, no, exactly that. Yeah, but that, as Malcolm said, it's not closing the loop, is it? And that's the thing.
Do you think we're about to launch, or the whole of MFT is about to launch a whole new patient management system, sort of middle of next year? I wonder if referrals and GP communications are part of that.
Well, they're going all electronic, and the letters certainly go electronic now to GP direct rather than any mail and that. But it's closing the loop, as Malcolm said. It's the fact that they can send something, but they never actually check where it ended up and that it's come back to them as a response. So it is closing that loop for me. That's the way I see it. I see it as, a circle of things that you start it off and it goes round, but it should ultimately come back to the GP, and he knows that issue's been dealt with. And I agree with you. I don't think that's happening. I mean, hopefully they'll smooth all these areas out. Because like you say, I don't think we're ever going to go back to the way we were. But if we don't, we need to be sure that we can, our patients are looked after, and everything's being dealt with appropriately.
Can I just say, in some sort of defence, the only time I've had to contact the doctor since last March, I actually had a urine infection, a really bad one. And I spoke to the reception at 8:30. She said, can you drop a sample in? I had that by 9. The doctor rang me at 11 after having tested it and was quite worried about it. So did a prescription, which he sent to my local chemist. He then said that he would refer me to the kidney people.
Yeah.
And he then rang back again an hour later and said, I've been on to the consultant at the hospital and you know, said about your symptoms and everything. And they don't actually feel that you need to come to see them unless these antibiotics don't work. And which they did. So, you know, I mean, he was really good. It was followed up so quickly.
Some that are doing an amazing job, and like I said,
I was really, and in fact, that probably would have been better than my going to the doctors.
Yeah.
Because he probably wouldn't then have rung up and then rung me back, you know. So,
Chris, that's amazing service.
Getting that. Yeah.
It's amazing.
I've had good results with my surgery. I phoned up the GP at one point in the summer when I knew I had an infection. I just wanted some advice. And I said, there's no, you know, I don't need to speak to her, but if you just ask her and you know, can I have a message back? And a couple of hours later, she turned up on the doorstep. And I hadn't asked her to come out. But about the flu jab, I need an egg-free vaccine, which the surgery had been chasing up. The nurse responsible had been chasing up for a couple of months now, and she just, in the end, she said she'd found out that the Department of Health had stocked up the egg-free vaccine, and she couldn't get it. So after the last meeting, I'd been ringing around pharmacies, and about 4 of them had said to me, no, they couldn't get one. So I spoke to the nurse again, and I said to her, I was going to write to my GP, the MP and to the CCG. And she said, oh, that's fine, yes. Anyway, in the meantime, I did that. And somebody in the surgery had a relative who worked in a Boots pharmacy. And the nurse got in touch with them and they said, yes, they'd be able to get the egg-free vaccine, but they could only do it on a prescription. And that's how I got my vaccine. But the nurse just could not get it through the normal NHS channels. And that just seems to be a really bad problem.
Yeah, and I just think, Evelyn, if you know, that was you getting involved and going various places to find the information, but what about the patient that can't do that? That the nurse couldn't get it, and that's game over. So that's the bit I worry about.
That's what I said to the MP, and I said also to the CCG, and because the problem was resolved, they sort of, you know, came back away from it. But I'm still going to get in touch with them again, because I want to know that next year people like myself are not going to have the same problem again. Because we shouldn't have to be doing it.
No, it should be there, and we should know what the needs are for patients.
Yeah.
And I've had 2 physio phone conversations as a result of the phone consultation with the, you know, the NAC clinic normal appointment, and they've been really good. They've been worked out really well. Excellent.
Yeah, good. Glad we're on it. That's good.
I haven't seen
I just think you need to be cloned, everyone at Manchester, at Withenshaw, because that service doesn't, or level of service, just doesn't occur in Liverpool. So there must be something in the water in Manchester when it comes to training and delivering of service. I was on a waiting list for 10 months last year or the year before, and I found out by chasing it up at North Manchester or one of your hospitals. And when I rang, they said, oh no, your GP was informed you got taken off the waiting list 7 months ago. And I'm like, what? But my GP blames the hospital. They never phone me or anything to say you're no longer on that waiting list. It's terrible. It is really, really awful. Having said that, there's a new locum now who's just brilliant. I'm finally getting subutamol or something, you know, for when you start your walks and you can't breathe, you're like dragging a truck behind you. So so I hope it's going to be a change. But the video thing is, it seems to be working out well. I had one with neurology yesterday, and he was it was good.
Good.
Anyway, so well done for all of you. You're brilliant because you're looking after your patients as always.
Here, here.
Yeah, you know. I said that when I first met you, didn't I, Chris? I was staggered. The way you know, the care you take over your patients. So yeah, well done. All credit to you.
Oh, that's nice to hear from you guys, because it makes our job a lot nicer if we know that what we're doing is making a difference to you guys.
It is. Yeah, it is.
Yeah.